much. Well, please go right ahead and keep eating. Don't stop on my account. If there's one thing I believe in, it's eating. A few other things, but I'm Italian, so eating is crucial. I want to really commend all of you, and especially Dr. Abbasi, for pulling this together for the second time, right? For the fourth time. Wow, see how time flies. So it is so important, and Dr. Abbasi knows that I am a family member of somebody with severe mental illness. I have a brother with schizophrenia, and so I have grown up with this as part of our life, trying to help my parents cope with it, and trying to help my brother, initially trying to fix my brother, and then realizing that it was a little over my head. So I know it, I guess, secondhand, but then also as a family member trying to cope with it as a teenager, wondering, is it contagious, this thing that he's got? So it's anytime I see us trying to take the mystery out of it and taking mental health out of the shadows, this is exactly what needs to happen, and we're never done doing it because there's another generation coming and another generation, and for some reason, mental health, what an interesting concept, is it's this mysterious thing. It's not like physical health. We still don't, the insurance, still we look at it separately. It's something that I guess you should be able to control, we think, because it's in your mind. It's not obvious. Everybody understands. You cut your hand, you cut your leg, you break your leg, you go to the doctor, you get fixed. But mental health, for some reason, remains in many cultures and in many societies, and right here in Lansing and East Lansing, there's prejudices, and there's this mystery, and there's stigma. Still, it's amazing, in the year 2012, still the stigma with mental health. Nobody would expect you to be able to fix your broken arm on your own, but yet we look to people and think, well, they can control this, certainly. And so it's very hard to understand, very hard to understand. So I appreciate your coming together. You're working with folks in the community on a regular basis. We have to constantly try to educate people about it. It's easy for us to say, it's easy for us to imagine that, in fact, we can control most things. We have influence, at least. We have choices, and we can exercise them freely. But of course, I'm not hearing voices in my head. I don't have other voices, I don't think. I'm not usually having to wrestle with myself. I can't imagine what it is. When my brother burned down an apartment complex, and praise God, nobody was there, but he heard voices that said, hey, put everything up on the stove, all the paper goods and all that, and turn it on. He couldn't tell you why he did it, but he was just sort of responding. And so there's advances in medication, there's advances in treatment and in therapy. We got to stay on the cutting edge of those. But one of the most important things we can do is to help folks understand that mental health is a lot like physical health. You can't control it all. You might need help. You might need medicine. You might need therapy outside yourself, outside your family. You might have to get professional help, and that's okay. That's okay. Nobody expects that you're going to be able to treat yourself physically if you get a serious physical ailment, and you can get a serious mental ailment that you need help for too. Depression is a serious thing. We've lost too many people in too many ways because they didn't seek help, because they were ashamed, they were embarrassed, things that they wouldn't be embarrassed about. I know I'm preaching to the converted, but what you're doing is very important, what you put together for the fourth time. I congratulate you all. I just wanted to come by and say it is very important. It affects so many aspects of our life. This thing that we take for granted. This thing that we take for granted. Just like we often take for granted our physical health until it's threatened. But for some reason, again, that mental health is an area that because there's so much mystery, because people don't understand it as much, they keep it in. And we have to continue to make it okay to talk about, to bring it out, because we can't help people if they're not bringing it out into the public, into the open, and asking for help. So again, thank you for what you're doing. Thank you for getting the tools and educating yourself so that you can better serve the people of this community. Wish you all the best. Thank you. Have a great rest of your conference.